information about the vaccine and other health and safety measures allows us, each one of us, to really make informed choices and protect our community. So thanks again for your input and your flexibility with us as we make these changes. But now let's get into some other updates. This Saturday is June 19th, Juneteenth Day, and this is the celebration of the emancipation of those who have been enslaved in the southern parts of the United States that have formed the Confederacy. And so we right here in Milwaukee, we're proud to celebrate Juneteenth in the lives of so many Black people who have been liberated. And I want to acknowledge that there is still a long way for us to go when it comes down to achieving racial equity in Milwaukee, but as well as across this nation at large. And so Juneteenth emphasizes the progress that has been made, but I hope to see more events of liberation for our communities of color, not only during my lifetime, but beyond. And there are many Juneteenth events across the county on Saturday. So I encourage you all to attend, listen, and learn at many of these events as possible. And if you need one particular event to attend, Northcott Neighborhood House is hosting their 50th anniversary of the festival right on MLK Drive. Please come down and join us. Parade will be starting at 8 a.m. They'll have a welcoming at 9:30, and the festivities will be happening up until about 4 o'clock. And if you are looking to get vaccinated, Walgreens has partnered up with Milwaukee Health Services, and we'll also have Health Connections incorporated to help with kid vaccination. So we also want to say that as a reminder, please continue to practice physical distancing, wear a mask, and wash your hands frequently while attending these events and gatherings. And of course, we also want to encourage you to get vaccinated. So please come down. But I also want to note that this week is also Men's Health Week. And like a lot of people, I'm working to stay healthy and working out all the time. And I know how valuable it is when we work together to really heighten the awareness of preventable health problems and really encourage early detection and treatment disease among both men and boys. And so when you think about it, men are less likely to have health insurance, less health insurance coverage than women. And women make twice as many preventative care visits to their healthcare provider than men. And so because men tend to be less proactive about our health, men are more likely to die at a younger age than women. Also, health disparities really start along racial lines with higher rates of hospitalization and fatalities from heart disease, whether we're talking cancer, diabetes, and other preventable diseases among Black men. But the greatest threat to men's health at this time is the pandemic. And COVID-19 is over 90% preventable with the vaccination, and the severity of infection is greatly decreased if COVID is contracted after vaccination. So let's continue to encourage the men in our lives to get vaccinated for their personal health, for their family, and for the safety of this community. And with that, I'd like to hand it over to Mayor Baird. Mayor Baird?
Well, thank you very much, County Executive. It's great to be working with you, and good afternoon to everyone. We continue at the city to be extremely proactive in trying to get vaccines in people's arms because we think that this is by far the most effective way for us to continue to lower the burden of this pandemic at this stage. We're very pleased with the work that was done at the Wisconsin Center. We're very pleased with the work that continues to be done at our health centers. But now, as I've said earlier, we're going to continue to work to get our partnerships with churches, with community organizations, with libraries, with sport teams. We're going to continue to work on those to get more shots in arms. So today at Prince of Peace, which is located at 1114 South 25th Street, we'll be offering vaccinations that started just moments ago until 4 o'clock this afternoon. Both today and tomorrow, the Brewers will be offering vaccinations once again at Helfer Field. That's that Little League stadium that's right next to the ballpark with the incentives of 2 free tickets. Now, let's keep this in mind. The Brewers have been red hot, and you can help them stay red hot by getting the shot in your arm and getting free tickets for the games tonight and for tomorrow afternoon. The vaccinations will be offered today from 4:10 to 7 p.m. and tomorrow, because it's a day game, from 9:10 a.m. to 1 o'clock. For fans who receive vaccinations at the first Milwaukee Brewers clinics that was held back on May 26th and May 27th, the second dose will be available for you on Friday, June 18th from 3 to 7 p.m. Going to tomorrow also, on Wednesday, June 16th, the following organizations will be offering vaccinations. Employ Milwaukee, which is located at 2342 North 27th Street, which is essentially the corner of North Avenue and 27th Street, will be offering the vaccines from 11:30 a.m. to 1:30 p.m. Just a little bit further west of there at Washington Park Library, which is located at 2121 North Sherman Boulevard, from noon to 4. That's basically where Lloyd and Sherman meet. That's a great spot as well. The library will also be offering vaccinations from noon to 4 p.m. on Friday. At the United Methodist Children's Services of Wisconsin, located at 3940 West Lisbon, from noon to 4, and Ascension All Saints Family Health Center, located at 2400 West Villard, from 1 to 5. Moving on to Thursday, June 17th, Our Lady Queen of Peace will be offering vaccinations from 2 to 4 p.m. at 2733 West Euclid Avenue. And also on Thursday, a great opportunity. The Milwaukee Bucks and the Health Department will be back at the Plaza at Pfizer Forum this Thursday from 5 to 7 p.m. So let's put that one into context. The Bucks go, they beat Brooklyn. Is it tonight? Whatever the game is, they'll beat Brooklyn and come back for that 6th game on Thursday from 5 to 7. Those who stop by for a vaccination will be entered into a raffle to win 2 free tickets to that night's Bucks game. So you get the shot, you go to the game. Again, to give you a context of this, we've done this before, and the odds are actually pretty darn good to win these tickets. I'd like to say they weren't as good as they are, but we had, I think, somewhere a little short of 24 people at the last time we did this. And so with those odds, if you haven't gotten this shot and you're a Bucks fan, this is the opportunity you don't want to miss. Again, keep in mind, those who stop by for vaccination will be entered into a raffle to win 2 free tickets to Thursday's Bucks game. If you get the vaccination, you don't win the tickets, you can still have a great time watching the game outside because the weather has been perfect for days now. Finally, the Milwaukee Community Kickball League will be providing vaccinations on Father's Day, Sunday, June 20th from 2 to 4 p.m. at James Beckham Park, which is located at 900 West Brown Street. I'm pleased to share that we remain at a moderate level of transmission for COVID-19 cases per 100,000 and a low level of transmission for percent positivity. This is the number that I absolutely love to report on. It has dropped from 1.8% last Thursday to 1.5% this week. So it continues to drop. That's why we're in that low level of transmission of percent positivity. It's going exactly in the right direction. With the disease trends keeping steady, I'm reassured that we have made the correct decision to reopen city facilities next Monday. As probably many of you know, the police obviously have continued the work that they do, the fire department, the first responders, the health department, the sanitation department, whether it's garbage pickup or recycling or snow plowing, they've continued their work. But many of the offices, including City Hall, have been closed. But that, of course, will change on Monday, June 21st, the first day of summer. So an appropriate day for us to get life a little bit more back to normal, but not completely back to normal. We will be opening with some precautions. Members of the public coming to City Hall and to other city buildings will be required to wear masks. We hope that that's going to be a requirement that will be long, but we want to make this a very seamless transition. Employees must wear masks in public areas and wear masks indoors continuously if they are unvaccinated. So again, another incentive to get vaccinated. I want everyone to be vaccinated. That's the best course of action to protect your friends, your family, your community, and yourself. So with that, I'm going to turn it over to Dr. Weston. Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First to our numbers, we're currently seeing in Milwaukee County an average of 20 new cases a day, and we're seeing about 1 death every 2 days. So similar numbers to where we've been. We saw promising initial results yesterday from Novavax. This is a small company in the United States on their clinical trials of the new COVID-19 vaccine that they've been developing. They studied the vaccine in about 30,000 people. And with 2 doses, it was found to provide 90% efficacy and like the other vaccines, 100% protection against severe disease, against hospitalization, and against death. So the vaccine that they're developing uses slightly different technology than the mRNA vaccines, that's the Pfizer and Moderna, or the viral vector vaccines like the Johnson & Johnson. So this vaccine introduces a spike protein. It's a harmless part of the virus that binds to our cells. They introduce that into the body to develop an immune response. So while this vaccine may not initially play a major role in the United States, as we have 3 other excellent vaccines that we're using to initially vaccinate our population, it will likely very much help to supply the rest of the world with much needed vaccine, and may also be useful for possible future uses, such as booster shots if that happens in the United States. Speaking of vaccination, I've heard from a number of people who've been infected with COVID in the past and now question whether they should still get the vaccine. And these questions have come even more so after a recent preview that was published of a study that's conducted at the Cleveland Clinic. So this study, it hasn't yet been peer-reviewed or published in a scientific journal to make sure it's high quality and well-performed, but the initial findings seem to show that workers at the Cleveland Clinic who had been previously infected with COVID but remained unvaccinated had protection from reinfection similar to those vaccinated for a period of 5 months. And many people have taken this to mean that those who have COVID in the past may not need to be vaccinated. But this would be a misunderstanding of the evidence from this trial and certainly a narrow view of the research that is widely available. So in a complete reading of this study, we see that even the authors themselves point out that they only followed their patients for about 5 months. As well as that those in the study, those that work at Cleveland Clinic, are typically younger, healthier than the general population. Now, to be sure, the jury is still out on exactly how much immunity is provided by natural infection from COVID. There have been many more studies that have shown a greater antibody presence, for example, in people who are vaccinated as compared to those who've been infected. Additionally, there have been multiple studies that show greater B cell immunity. So these are long-term memory immune cells in our body. And there's a greater predominance of those in people who are vaccinated as compared to naturally infected. There's also studies that have demonstrated much higher rates of reinfection in those previously infected as compared to those who received the vaccine, which would seem to contradict this study. Now, of course, there's also the fact that some of the new variants that are widely circulating are pretty good at evading the natural immunity that comes from previous infection. That is to say, previous COVID infection does not protect you from several of the new variants as effectively as the vaccine. Our bodies build immunity by being exposed, and ideally exposed more than once, to whatever the invader is, and that allows us to build up that immunity. So in the end, without a doubt, of course, vaccination is a personal choice, but make no mistake that it's a critical choice. And when you weigh the pros and the cons of vaccination, the decision is clear. And it's clear regardless of any previous infection with COVID you may have had. We've now had nearly 175 million people in the United States receive the vaccine. There's very few vaccines or medications for that matter that have gotten or have been given to such a large population. And that really allows us to understand both the effectiveness, but also the safety profile of the vaccines. The benefit of vaccination is that near 100% protection against severe disease, against hospitalization, and death from COVID. Now, the downside to the vaccine is near zero, aside from a sore arm, as I had, or for some flu-like symptoms for about a day or so. So do your research, talk to your doctor, and when you're talking to your doctor, remember there is a reason that 96% of doctors that were recently surveyed by the American Medical Association report themselves having chosen to be vaccinated. The vaccine's safe, the vaccine's effective, whether you've been previously infected with COVID or not. Thank you and stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. The success we've seen with our incentivized vaccination clinics is encouraging, especially as vaccination numbers in the city of Milwaukee rise. Our latest data shows that 51.2% of Milwaukee adults have received at least their first dose, and 45.1% have completed the vaccination series. We're truly grateful for the partnerships we've had with organizations like the Bucks, the Brewers, and Summerfest. Their generosity and commitment to vaccinating Milwaukeeans has been instrumental in increasing our numbers. If any businesses or organizations are interested in hosting a clinic or have a great incentive idea, please reach out to the Milwaukee Health Department at 414-286-6800. As Mayor Barrett mentioned, anyone vaccinated during the clinic on Thursday at the Fiserv Forum Plaza between 5 and 7 p.m. will be entered to win 2 tickets to that night's Bucks playoff game. The winner will be randomly chosen immediately following the end of the clinic, notified, and sent digital tickets. Those interested can find the health department at the southwest corner of the plaza near the large Bucks statue. Thanks again to the Milwaukee Bucks for their generous donation. We appreciate everyone who has taken the initiative to keep themselves and their families safe by getting their COVID-19 vaccine. While offering incentives at clinics encourages residents to get vaccinated, there are businesses such as Black Husky Brewing who offer incentives to anyone who's been vaccinated. Incentive programs are determined by individual businesses or organizations, and the health department supports anyone who chooses to offer incentives. We know, based on the gating metrics the mayor shared, the prevalence of COVID-19 in our community continues to decline. However, if the virus is not fully eradicated, and the danger to those who are not yet vaccinated remains. The best way to protect yourself, your loved ones, your family, and those who are not eligible to be vaccinated yet, such as children under 12, is to become vaccinated as quickly as possible. For the full list of sites, visit milwaukee.gov/COVIDvax or healthymke.com. Beginning this week, the Milwaukee Health Department COVID-19 hotline will be closed on Saturdays. Additionally, a reminder, beginning today, the Tuesday and Thursday hours at the Northwest and Southside Health Center vaccination clinics will shift to 12 to 6 p.m. on Monday and Wednesday. Friday's hours will remain from 10 a.m. until 4 p.m. Thank you.
Okay, let's hand things over now to Dr. Eve Hall, who is the president and CEO of the Milwaukee Urban League. Dr. Hall.
Hello, can you see me?
Not yet. We can hear you though.
Huh. Interesting. I don't know what's happening today. There we go. There we go.
Oh, we see your little face. All right.
Hey, everybody. Well, first of all, just thank you to our county executive, to our mayor, to the head of our health department. You know, the work that's being done in the city and the county, I think is really making a difference. And so, you know, given the organization I represent, which is, of course, one of the communities hardest hit during this pandemic, the African American community, the work that we're doing is really now critical too. We are part of what we call the All In campaign, which is a national collaborative involving 25 cities around the country. Milwaukee was chosen by the National Urban League to participate. And this involves, of course, the CDC, the Coalition on Black Civic Engagement, the National Action Network. And the purpose of this collaborative, everyone, is to do 3 things. One, for each urban league in the 25 cities to also pull together a coalition of what I call vaccine champions, and really just kind of coordinate what is everybody doing, how can we collaborate even further, making sure that we're pushing good information on all of our social networks, you know, collaborating with others on this vaccination. It is also to work with others to continue to identify non-traditional sites for the vaccination. I think the mayor mentioned a number of sites already that are being utilized, you know, groups that are being utilized. We push the same thing. We're working with different groups and especially like Pastors United and others. We're looking for the Urban League to actually be a vaccination site at some point because we have both Frederick and Aurora on our board. So, you know, we want to be access for the community. Thirdly, it is also to gather some data. it is very important for us to look at, how are vaccinations being distributed? What are some of the challenges? What have been some of the successes? Both information that will be utilized by CDC, but also by the National Urban League, because I think, as many of you know, we have the State of Black America every year. We're always looking at, what the situation is for African Americans and other communities of color across the country. What's important for us, just like everyone is talking about, is really informing the community, Kimberly and everyone, because there is still misinformation. There is still a lot of fear and mistrust. And even this weekend, we had our laptop awards on Friday and Saturday. We awarded 57 laptops to students and their parents. And it was interesting as we would have conversations and they would come in one family at a time to receive their laptops. We had to make sure people were vaccinated or not vaccinated, so we knew how to handle our masks. And there were a good number that were still hesitant. We're still not getting vaccinated because of fear and not really feeling comfortable enough in knowing the information. So while it may seem like there are a lot of efforts going, which there are, there can't be too many right now, because the more of us that are vaccinated, the better, and the more we can return to normal. So I hope that kind of touches. I think we know the numbers. I know at one point it was 1 in 4 African Americans that were being vaccinated. I think with, the increased access and participation, I think we may be down to 1 to 3. One of the other pieces that we're looking at too is we know that only 60% of Black business owners may be able to get their businesses back in order. And, again, the way we handle this vaccination is also going to have economic repercussions. And as the Urban League, we're also looking at just the continued economic vibrancy of our communities.
All right. Thank you so much, Dr. Hall. We're going to go ahead and open things up for questions from the media. And the first question comes to us from WTMJ and Mary Jo Ola. She has a question for Dr. Weston or Commissioner Johnson. Her question is, the CDC reports the Delta variant of coronavirus accounts for almost 10% of new cases in the US and declared it a, quote, variant of concern, end quote. How concerned are you about this variant? What should Wisconsinites know about the Delta variant? And has the Delta variant been confirmed in the state of Wisconsin or in Milwaukee yet?
So I can start on that. I do think the Delta variant is quite concerning for people in Milwaukee, for people in the state of Wisconsin. So what we have is a variant that has very quickly become predominant, first in India, and we all saw what happened and what has been ongoing in India. And it's now become the dominant variant in the UK. It's overtaken the UK variant, or now called the Alpha variant, in the UK, and it's over 90% of what we're seeing in the UK. And now it's following a similar trajectory in the United States, around 10% now. That's an increase from 6%, I think, just last time we talked on Thursday. And so it's increasing dramatically. And usually when it hits about 15 or 20% is when we see a significant uptick to close to 80% within just a few weeks, as we saw with the UK variant. Now, the reason why the Delta variant is particularly of concern is because it's so much more contagious. It's so much easier to spread. And so when we think about the transmission of this virus, we often think about it as space and time. We've done that since the very beginning. If you're in an enclosed space with somebody, how long do you have to be there for enough of the virus to transmit back and forth? And so while the time may have been however many minutes a year ago, that got cut close to in half with the B117 variant. And now we're cutting it again to an even shorter period now. So it takes less of the virus to cling on and to transmit now than it did before. So certainly the Delta variant is of concern. The good news for those who are vaccinated is the vaccination after you've received after you're fully vaccinated appears to be very effective against the Delta variant. But certainly for unvaccinated people, it's very concerning seeing that widely circulating. We know it's in Wisconsin. I'm not sure if it's in Milwaukee yet. Commissioner Johnson may have better insight into that. But to be frank, it'd be very surprising if it's not in Milwaukee, as much of it is in Wisconsin as in the United States.
Thank you, Dr. Weston. I can speak to the Delta variant in Milwaukee. It was detected in Milwaukee County in 2 cases at the end of May. So based on what we've known in terms of how the disease spreads and how the Delta variant, how contagious it is, it's highly likely that it's quite prevalent in the city of Milwaukee.
Commissioner Johnson, the next question is for you from Chuck Hornbach with WUWM. He says, any qualms about 16,500 Bucks fans inside Fiserv, many of them not wearing masks? Vaccination rates would suggest several thousand of those fans may not be vaccinated.
It does give me a slight pause. I can say that we have to remember that people at these events aren't necessarily all from Milwaukee. So they do pull from the entire state and the counties around us who do have higher vaccination rates than we do in the city. And I also can say that I attended one of the games in the last week, and there were actually more people wearing masks than I thought there would be. So I was pleasantly surprised. But again, I think the message that we really need to keep hitting is please get vaccinated if you haven't been yet. It protects yourself and your family and loved ones. And if you're not vaccinated and indoors, the recommendation is to continue to wear your mask.
Okay. We'll stay on the topic of the Delta variant with a couple of questions coming from Sharon Bagenda with CBS 58. And the first one is for Dr. Weston. And Sharon asks, Dr. Weston, is the Delta variant peaking in younger people? What age groups are most affected?
So it may be easier to think of who's most affected by vaccination versus unvaccination status. And so we certainly see that our older populations, in part because of the vaccine rollout, in part because of risk, and in part because of who's sought out the vaccine, our older populations are much more likely to be vaccinated than our younger populations. And so that naturally leads to much more of whatever variant of the virus is out there hitting younger people. And that's just because less younger people are vaccinated. There doesn't seem to be, and this is still being studied, there doesn't seem to be a predominance or a preference of this variant for younger people. That a lot of times is reported early on with variants, but it doesn't seem to be, but we'll certainly continue to follow it. But I think the take home point is we live in a society now of 2 different groups. We have vaccinated, fully vaccinated individuals who are very protected from this pandemic, from COVID, from all the variants. And then we have unvaccinated folks whose studies and analyses have shown are at a very similar risk profile to how they've been for the last 16 months.
All right. The next question from Sharon is for our city leaders, the commissioner and for Mayor Barrett. And she asks, are you concerned about the Delta variant? And what is your advice for people in Milwaukee?
Well, mine's pretty straightforward. The commissioner can talk about the health aspects, but it's pretty clear. You get the vaccination, you're in better shape. If you don't get the vaccination, as Dr. Weston just said, you're putting yourself and the community at danger. So get the shot. It could not be any clearer than that.
And my message is exactly the same. Get vaccinated.
All right. Well, let's talk about the success of some of our vaccination clinics. This question comes from Spectrum News, and it is, what was the success rate of the last ticket raffle that the Bucks had in terms of vaccination rates? How do you think it would compare to the one that is happening on Thursday?
We've decided to really define success at all of these events by getting a shot in an arm is a success. Certainly, we'd like to see hundreds of people. I think the Bucks, their generosity, I think we all would like to see hundreds of people get vaccinated at these events, but that's really not the case. I can say that the individuals vaccinated at the last event for Bucks tickets were really our target audience. So I think when they were younger, predominantly male, I think that's who we really want to get shots in the arms of our younger population because they're not as well vaccinated, and these that incentive specifically seemed to hit the mark.
So I'll couch it a little differently. So picture yourself, you have not been vaccinated, but you're a Bucks fan. Your goal should be that you are the only person who shows up to get vaccinated, because then you'll have 100% chance of winning these 2 tickets. So I'm trying to help you win these tickets. And if you are the only one that shows up to be vaccinated, you will win these tickets. So I would like to deliver that message individually to about 5,000 people. If you're the only one who shows up, I guarantee you'll win. Let's see how many show up.
Sounds like a potential win-win. The last question I see in front of us is from Sari Lusk for Eve Hall. And she asks, any early thoughts on what is working and what is not working with the vaccine distribution to ensure it is equitable? What are some solutions you think are needed to overcome vaccine hesitancy?
So the first question about being equitable, I think honestly, initially, there wasn't a lot of equity. There were still not enough sites that were being used to reach the communities of color that were especially hit. But I believe that, you know, as that realization really hit home, the mayor, the county exec, you know, the health department really stepped up to do some intense outreach. So I feel good about where we're at, but once again, I will say there's still a lot of room for, you know, identifying even more sites for people, because we've just got to be so intense and just permeate, quite frankly, the field and the access points for individuals. In terms of the information and kind of how can we help with hesitancy, I will tell you what I've learned is that the personal connections that we make with people can make a difference. And case in point, I will go back again to our laptop awards this weekend. As I encountered families or individuals who had not taken the vaccination, I had personal conversation with them and encouraged them to do homework, to find out information. And I shared with them the fact, quite frankly, everyone, that I wasn't taking the shot. When it first came out, I was very hesitant. I said, I'm not taking it, and I'm not going to get it to my mom. But then I also had to take a look at, I am a leader in this community. You know, people were asking me about it. I'm not going to lie if I'm not there. So I had to make sure that I was very diligent. So I went to webinars. As a National Urban League, we even had to do our homework and be part of webinars which involved national experts and, quite frankly, in this case, a lot of African American medical experts who could help to allay the fears and concerns that many people felt in our communities due to history and even due to sometimes the present day inequities in terms of the incorrect prescriptions being given to our communities, or not enough access or medical attention that oftentimes ends up in death or just unneeded diseases and results. So I'm looking at more of the one-on-one, really utilizing each of our platforms where we can have personal conversations with people, where they respect what we're saying, and encourage them to get as much information that they can, because that's their responsibility, so that they can be at peace. I'm proud to announce that there were several individuals on Saturday, as a result of me having a conversation, that are now thinking again about, you know, this is something I probably really need to do. So.
All right, Eve, thank you so much for those insights. Any other questions from our media? Okay, looks like that's it for now. So that does it for our briefing for today, Tuesday, June 15th. We'll see everyone back here on Thursday, June 17th. Have a great afternoon, everyone.
Thanks, everyone.
Thank you.
Thank you.
Thank you.